When your old career gives you lemons, throw in some ice, mix in some vodka, and call it a podcast. From the Mac of All Trades studio in Fairport, and driven by Victor Chrysler Dodge Jeep Ram, it's Billified, the Bill Moran Podcast.
Welcome. Thanks for getting your pod on. Thanks for keeping the tush push. Oh, thanks for telling a friend. That's how we spread the word about the pirate ship. Danny is here tonight. We'll have special guests joining us. We're going there, talking about the prostate. Well, it comes up once in a while, I think, over masturbation, whether or not is there a healthy limit? That's the way to keep your prostate healthy. Or we shouldn't say that. We should say ejaculation would be a way to keep your prostate healthy so many times a week. Mm-hmm. You seem very uncomfortable talking about this.
I'm not
going to try to keep this as clinical.
We don't know. That's why we're bringing somebody in.
Well, the guy's an expert, right?
He's a pro. He knows.
Yeah, he knows assholes. Right? And that's how you get
he's a urologist assistant.
Yes.
He's a PA for a urologist.
Yes.
He specializes in urology.
Okay. Well, the
study of urine.
The way to get there is the prostate.
Yeah, that's
the
how you
way
do
to get to the prostate is speaking of that, along the same lines, the tush push play that gained notoriety, Danny, thanks to the Philadelphia Eagles, I believe.
Oh, not the country line dance?
No, I don't think so.
Came out about the time of Icky Breaky Heart. Do you remember that?
Yeah. What did?
The tush push.
They did?
Yeah, it was a line dance.
I don't remember.
There used to be this show on the Nashville network, TNN, when it was a country station.
Who the fuck watched it?
Called my grandmother. Called the White Horse Saloon. And they had line dancing with couples every day from 3 to 5.
You're
right?
So sad.
How about
like
this?
The Lawrence Welk hour?
So my grandmother would watch it.
Yeah.
She loved it. She thought it was fantastic. I don't know why. Just watching couples dance. And then she would take note of which guy was with which girl. And if he was dancing with a different girl, he must be cheating. Or, he must have left that one. They must have had a falling out. Like she had these scenarios in her head. She didn't realize they were just professional dancers. Just
bored in silver.
Yeah, right. So she was in her 70s. This is before OJ.
Yeah.
Right. So she needed something to watch. Then OJ happened. We forgot all about the White Horse Cafe.
Hang on a second. What is the tush push dance?
Was one of the line dances they did was the tush push. It came out with the achy breaky.
Did not know.
Yeah, this is post to the electric slide though.
Okay, I did not know.
This is when line dance became a thing.
Because the tush push, I thought was the Eagles used it to help their short yardage success, and I think they used it in the Super Bowl where they won 40-22 over the Chiefs.
There was a lot. They pushed the Chiefs tushes around.
Yeah. But so they voted. They had a debate at the owners meeting.
Yeah.
And 16 out of 32 NFL teams supported a proposed ban led by the Green Bay Packers and supported by one Sean McDermott.
Yeah, he was pretty adamant about
it. Safety concerns is what they say in their argument, despite limited data available about it.
There's limited data because it's only been around like 3 years. For years, you couldn't push anybody or pull anybody across. And then somehow the rule got changed, and the Eagles and the Bills have taken advantage of it because they have two quarterbacks.
Well, why would you? Okay, so why is Sean against it? Like, here's the thing. I thought, is there a chance they're going to outlaw it because it's not as exciting of a play? It's not exciting. And it's almost a foregone conclusion that you get the first down.
Yeah,
so I go, it's going to go away. Then the Bills fucked it up. Yeah. I think more than
once. They got it the first time.
Yeah.
You go back and watch the game. Okay. They got it the first time.
All right.
But then Kansas City caught on.
So I feel like once they screwed it up, then I'm like, it's here to stay now because it's not 100% all the time. And it's not an exciting play. It's just not.
No, if I wanted to watch rugby, I'd watch rugby.
Well, you know what I mean? So, and I feel like the NFL's ever-shifting rule book, but I guess that's how you keep the game fresh and you keep people interested in we're talking about it, right? So that's the thing. But I mean, is it strategy-based versus health concerns? I'm not really sure.
Well, there isn't enough. People are like, have you seen the data? Because the media, They're all about film until they have data, and then the data like is supposed to dictate. You're not going to have data on it. Here's the thing. Sean McDermott, and I had the question about this. I asked some guys from Hashtag Sports their opinions. I actually asked Greg Connors about his too. We'll talk into it in a second. But the thought is the Bills ran a very conservative offense considering the fact that they have Josh Allen. Now, people thought maybe it's because he didn't have any weapons to work with. They had to bring an extra offensive lineman every once in a while. Why are they just, running the ball first? Why are they so conservative? And the guys from Hashtag said, well, here's the thing. You got to remember, Sean McDermott had a front row seat to watching Cam Newton's career, climax and then immediately take a nosedive.
Right.
Because they would do the same. The Cam Newton.
They beat the shit out of him.
Right.
Cam did too.
Right. And who does, as far as his body type,
yeah,
who does Josh Allen get compared to?
No.
Cam Newton.
Right.
They don't want to see what happens with Josh Allen, who
Right.
they now handed a third of $1 billion to.
100%.
Right. That to happen to him. And so when you watch Allen go through this, he does when Sean McDermott talks about his posture, and there was a radio station west of Batavia that was like, McDermott made a silly argument. I'm like, no, he didn't. You make the arguments, dumbass. Look at Allen. Watch the tape.
You get so mad.
Watch the tape.
Why do you get all worked up about these guys?
I know.
Because
I know what I'm talking about.
Okay.
So watch the tape. Watch Josh Allen. Do you want your quarterback being treated like a pinata 6 times a freaking game?
No, I don't.
And it adds up. It's not going to hurt him right now. It might, but it could hurt. It could shorten his career.
I put something on Facebook and someone wrote, should it be outlawed? And someone wrote, the NFL allows hard hits, turf injuries, and hip drop tackles. Yet suddenly a rugby style scrum is where they draw the line. Why is this the hill some coaches are willing to die on?
Because it's the quarterback.
And
it's the most important guy in the organization.
You really could. I mean, I keep thinking just hit your neck the wrong way.
Right.
Or your head twist.
It's over.
I mean, to me, that's it.
And I think McDermott, the question is that, okay, why run this play then?
Yeah.
That's where I think people have an issue with McDermott, and I do too. I agree with McDermott. This play needs to go. I don't like the play. I hate the play. For Allen's sake only, I hate the play.
Maybe he is maybe you won't see it at all this year.
Our friend Greg Connors, I said, why would McDermott then go back on this? Is it because he's being told to? Is it because his fellow coaches are saying, Sean, we got to get rid of this? Because it's worked out for the Bills 95% of the time. He goes, because he will do whatever it takes to win regardless of the rule. But if he can eliminate the rule, now he doesn't have to do it anymore.
Right.
Which makes a lot of sense.
Yeah.
The thing is, though, is that Tom Brady used to run this play all the time. 5 wide receivers, he'd get under center. So now you have to put 5 guys on the 5 receivers. So now there's only 6 on 6. 6 defensive linemen, 5 offensive linemen, and a quarterback. It gets everybody out of the area, and you know what Brady's going to do. He's either going to go to the left or he's going to go to the right. And 9 times out of 10, he got a first down. Yeah. And he was safe. He rarely got hurt other than one time when a guy went after his knee, and they changed the rule. You can't go after quarterback's knees anymore. They want to protect the quarterback. Why couldn't McDermott run that play, because they run the same offense the Patriots did, or B, here's the other thing. Here's what Kansas City does. Kansas City used to run the play with Kansas City would run the play with, when you asked, Kansas City runs the play with Travis Kelce.
Yes.
So they have the tight end who also is worth a lot of money.
But he was a quarterback in college.
Yeah, but still, you could practice this at home. It's not and work on it and make it work. Like Dawson Knox. What else is Dawson Knox really doing?
Yeah.
What is he doing? He's getting a ton of money to do what? Not catch footballs.
I don't know.
So you might as well put him under center and let him take the snap if that's the case.
That's true. That's true. I hear what you're saying.
Right. So why did McDermott if he's against it, why is Josh Allen, running this play every time it comes?
I just
because it works.
I think it's funny. I do find it to be somewhat of a boring play, but I guess in a playoff game, getting the first down isn't all that bad.
Boring until it gets stopped.
Well, right.
Then come the reviews. But usually, then come everybody cheering for the defense.
And I just thought it was and so I thought it was going to go away.
Against the Rams, they didn't run it well either. They got stuffed, and then they called the timeout and it cost them the game. So, I mean, it's not an automatic.
No. Well, not anymore. It sure seemed like it was.
Mm-hmm.
I mean, it really did to me for so long. And that's why I thought it'll go away because of that more than anything else.
No, I mean, I appreciate McDermott's reasoning. I appreciate the fact that he wants it out because I don't want it in football either, but for Josh Allen's sake. If we didn't have a let's say we had Ryan Fitzpatrick and the Bills sucked, I wouldn't care. Okay. No offense to Ryan Fitzpatrick, but I want to protect my quarterback. Now, but the thing is, though, is that, but you could run the play with somebody else, or you could run the play that the Patriots used to run that worked like 99 times out of 100. That's where coaching comes in. That's where I get frustrated.
Yeah.
It's like, you're against this play, but you could have run something else and you didn't do it.
I know, but
so you put your quarterback in line. Now, like Greg says, they want to win.
Is it hypocrisy? I don't know.
It's not so much hypocrisy. It's just idiocy to me.
Well,
if you're against it now, why were you running it so often?
But I think they ran it, and then he's seeing maybe he's seeing data we're not seeing.
But he didn't talk about it. Unless he wants to keep that under wraps.
Probably
have this proprietary AI that they don't want to share with us.
Or is there something else that he's trying to push through the league? And
it could be.
Could this become like the political floor of, hey Dan, if you vote this way on this, I'll back your silly bill about
it
whatever.
Political,
which I know sounds ridiculous because it's the NFL, and why would you do that? But I wonder if there is some aspect of that.
So the Packers put the proposal that you can't push or pull the player. In other words, they got to do it on their own. You can sneak all you want, but you can't get pushed.
To push, and that's what we're talking about. Is the and that is, think about that. That is where somebody could really get hurt when someone else is like pushing you from the other end. Mm-hmm. It's lovely. Lovely the way that all works.
They call it the brotherly shove.
Yes, in Philadelphia, the brotherly
in Buffalo,
shove.
They call it the Buffalo snowball plow.
Well, I mean, look, you've got linemen that are legally rearranging body organs every Sunday afternoon on players.
In urology, they call it the prostate.
Yes, they could. Somebody's head could be right up there.
Yeah, you never know.
I'm very excited because we'll take a break here. I know it's a little early from when we normally do. But we've had a lot of questions about the prostate on the program. Yes, it was not just me. It was other people as well.
Oh, okay.
Maybe you weren't here, but I think somebody chimed in. Maybe it was Laura. I thought.
Laura was worried about her prostate.
No, she was saying something about
Kevin's prostate.
Prostates. And then I think you said something about a prostate once.
I probably did.
Yeah.
Oh, dude, I'm worried about all the body parts.
Yes, I know. And so there came up some things. And then Dan said, hey, I have a friend who works as part of a urology team.
Yes. And
I'll see if he can come in. So I'd like to keep this as somewhat academic as possible without being too dirty, because it is the prostate.
No, yeah, we don't want to like.
But we've heard of ways of keeping the prostate healthy.
Yes,
right. Which is, it's almost like you got to clean it out.
Yeah, we don't want this to turn into like an immature sophomoric morning show.
No, I don't know.
We want to have fun.
I mean, I'm not sure.
But this is something guys don't like to talk about.
Well,
or people don't like to talk about.
I think there's things like erectile dysfunction. I will tell you this: my grandfather died of colon cancer, and I know it's slightly different, but to check the prostate, you got to go the same way as the colonoscopy. And he died of it because at 69 years old, primarily because he was too proud to have someone, visit his anus.
So my father died of colon cancer, but he went and got checked. The problem was the second time he got a colonoscopy, it's not like it is today where they put you out and all this other stuff. You were awake and it was awful. And he was like, okay, never again. And he waited too long and he passed away. I know Vince Lombardi died of prostate cancer for the same reasons your grandfather died of colon cancer.
I'm pretty sure
he didn't want to get checked
out. Story, because then I had heard that there was like blood and stuff and coming out in his bowel movements. And then I think also the prostate had not been checked. Whatever. Point being, let's not be too proud to have this. And now, I mean, there's been many people who've even had the prostate, and I didn't put this on the list of questions, but had it removed. And
Joe Torre and Marv Levy both had it removed
because of cancer. And I was told by my doctor, if nothing else gets you, prostate cancer will. Like if you live long enough, you're going to get it.
Took out Moses.
Yeah. Is it
120 years old?
Ah, amazing.
No,
how did you do that?
Yeah, it's in Deuteronomy.
It was his burning bush that was going on there. All right, so we will take a moment and we will talk to do we do just first and last name?
Yeah.
Is there any anonymity?
Anonymity? No,
anonymity. All right. We will get to that right after this.
So outside, it's April showers this afternoon that are rolling in. Lower Manhattan looking gray after we had that sunshine. Hold on for
about a 2:45. Yes, I woke up this morning. It was about a 2:45. I woke up because I had to pee.
Happened to me this morning too.
Sure.
3 a.m.
That's right, buddy. Prostate blues. Just ain't right. So I believe it came up and talk about masturbation and keeping your prostate healthy. How many times, and clinically speaking, you need to ejaculate to keep your prostate healthy. So that's where I think the original impetus of getting somebody who has some scientific knowledge about this would come in. And Dan had, I forgot he was in your band. Yes. You said the original Diggler's Bridge.
Yeah.
Was he there at East End when you were the big rock star and we took that picture? Oh, he's not.
No.
Okay. But the original
the 04 to 08 version.
The 04 to 08 version.
Yeah.
Okay.
Mm-hmm.
Yeah. And we didn't come around as the break room until 08.
Yeah.
That was when we started. Maybe it might have been 09. No, it was 08.
It was 08. Yeah.
That's right. And Dan Barney. So Dan, you are a physician's assistant in a urology office?
Correct. Yeah, with the University of Rochester.
Okay.
Primarily outpatient urology, so seeing patients in clinic pretty much 5 days a week.
Yeah.
And I've been in urology actually since 2006.
Okay.
So that was my kind of second stint. Yeah, it's more than I can even fathom to count.
I can only imagine.
Yeah. And then
well, see that Danny, I to see Danny just turned a nice shade of red. I had to throw it in there. Well, here, so as the physician's assistant, I always go, why not become the full guy? You're doing everything. You probably have as much knowledge.
It's no, I mean, no, I mean, we work with some extraordinary doctors, and
okay,
some of the smartest people I know, and it just kind of started out where, this is, back in high school in the mid to late-ish 90s. I had an aunt who was a physician assistant, and I was like, wow, can you stitch people up and, put in casts and, all that stuff? And she's like, yeah. I'm like, all right, cool. That's what I'll do. And then everything kind of fell into place, and, got into RIT right out of high school. And
because I would think, like, if you're a doctor, you got into RIT.
Into RIT, yeah, their PA program.
Their PA program. Yep. I know somebody else who did their PA program. But I'm thinking, like, you're a doctor, and let's say you're a dermatologist, and somebody goes, hey, you got a minute?
Yeah.
I got a cocktail party. Take a look at this. I got to think, have you ever had somebody go, hey, a lot of things have changed in my body here, and I'm peeing a lot. Do they say that to you ever?
Sure.
They do?
Certain things, like, I think maybe, the prostate, comes up a little bit more often, or,
it's a little more, people are more willing to talk about it.
Right. Yeah. And it's, that's the segue into other things. I get questions on kidney stones and, random things, bladder, it's all part of urology, but I just kind of somehow migrated towards the men's health or sexual medicine aspect of it.
Okay.
You don't go to school just to do that. It was kind of, got into urology and noticed that, hey, more of these patients are coming back to see me.
Right.
And, kind of word of mouth, and it just all of a sudden it becomes a primary part of your practice without even, necessarily setting out that goal in the beginning.
Gotcha.
Have you thought about starting your own YouTube channel?
Not yet. No. We'll see how today goes.
So there's been a lot of talk. We did talk about how frequent ejaculation, whether through sex or masturbation, helps the prostate, or how much is there that optimal frequency base? And should it be based on age? Is it based on whatever? And does too much or too little increase the risk of prostate issues? I will put a little story in here with the fact that I was like hyper horny when I was in my 20s. And I think if I wasn't having sex, I was probably pounding something, right? And I had a prostate infection in my early 20s. And I had to have it checked several times, and it would be like, it almost feel hot. Like I could feel it hot. And I think it was just overuse, because I was told at the time, well, a lot of young guys get this. I was like, I don't know. I didn't know any young guys that got it.
There can be, there's certainly the more activity going down there, can increase risk of certain things. There's, statistically, when you look at it, prostatitis, right, we all think of it as a bacterial infection, but only 20% of cases of prostatitis are actually from bacteria.
Okay.
Lots of it can certainly be that, and tends to come with more urinary symptoms, burning, urgency, frequency, slowed urine streams. Sometimes if it's really a bacterial infection, people can feel like they have the flu, like they feel sick, run down. And a long antibiotic course is really the only thing that gets you out of that. 80% of those cases, though, are not bacterial related. And that can be from local reactions, inflammation, hyperactivity of the pelvic floor. Certainly when, people are taking matters into their own hands, there can be, some tension in the lower, the
best way to say that I have ever heard. I'm sorry to interrupt. That was poetic.
Yeah,
that was poetic.
There's, there can be tension in the pelvic floor, muscles can get tight. And that can actually, inhibit, good blood flow. It can impinge nerves that go into that area, and, pelvic floor dysfunction, hypertonicity, that can cause, symptoms that mimic prostatitis.
Okay. And can it, when you say mimic, can it also, will you have a swelling of the prostate?
Discomfort, pain.
Yeah.
And the prostate tends not to get swollen in that situation, but there's ways we have to find that out.
Yes.
Which you alluded to earlier.
Right. Well, it is. I mean, I think, is that the only way to check the prostate?
In general, an educated finger and a blood test, the PSA.
Are they not doing the finger upon physical anymore unless you, I don't know what it would be, like have a history or?
Right. It's interesting. There's all sorts of, research that comes out that's for rectal exams, arguing against prostate exams. Like, what are we actually, saving lives doing this? And, every so often things come out as well about getting a PSA check, the blood test. Back, I think it was in 2012, it's the U.S. Preventive Services Task Force recommended against routine prostate cancer screening. And there's actually a study that came out very recently that California especially has been seeing a significant increase in prostate cancer since around then, when previous to that, there was actually a stagnation or a decline.
Oh, wow.
So they stopped really, being proactive in screening men for that. And they're actually finding prostate cancer in more advanced stages now. And in my opinion, it's, there's really only, a couple good ways of screening for prostate cancer. And, that includes the PSA blood test and, yes, a prostate exam.
What is, go ahead, Dave.
Didn't you, when you were with Weeze's show, didn't you, Tommy and Weeze and everybody all get prostate exams on the air?
Yes. Thank you for reminding me of that painful moment.
Congratulations.
But you made it sound like it wasn't that big a deal.
Well, because I had several by that point. Because I did when I was younger. I went a lot. And I remember my doctor saying to me, a lot of young guys, just take this. But I would get them, like, it felt like it never went away sometimes. And sometimes I would get fevers, and I could kind of tell what it was. I think one, could this be, because I did get a kidney infection where I was like peeing blood at one point. And I was in such pain that I practically collapsed. I didn't realize how painful that could be. And somebody's like, well, how did you get something in there? Because I was told is like really rare for men to get a kidney infection.
In general, it's surprising it doesn't happen more often, just because that's, it's an area that is just littered with bacteria, and viruses, and there's a hole down there. Bacteria go up, and if an infection goes on too long, it can keep essentially just going upstream, and if you don't have as much water intake, your system's not flushing itself out, and it makes it easier to develop that sort of thing.
So okay. What I was just thinking as you were talking previously is what is the function of the prostate? I don't know that most people really understand it. It's a gland, right? That sits
It's
sort
a
of
gland, and essentially it makes semen
yeah.
to mix with sperm and
Right.
procreate.
So,
That's about it.
And that's about it. And I would, when men have had this room, but does it also play into any part of erectile dysfunction?
It can sometimes.
It can.
Yeah, get in the way of blood flow, nerve function.
Okay.
But it's not the most common reason why men end up with that issue.
Right. So when men have had, and there's a few guys that I know who have had their prostate removed, and there's a whole procedure. I think Dr. Drew at one point was talking, he had his taken out, and what a process it was healing from that and coming, I guess, getting all kinds of function. I would assume, is it because of you're cutting the muscles, or is there some kind of connection? Does it affect your sex life?
Yeah, for
Lots of
sure.
questions.
Yeah,
It does.
there's a neurovascular bundle that goes, right around the prostate, very close to it, and they have to move those things out of the way in order to take the prostate. There's been the more of a focus on certain surgeons trying to do what it's called nerve sparing, procedures
okay.
where you try to have the least amount of an effect on the nerves as possible. If you cut the nerves, that just basically blocks the signal from your brain down to the
Yeah.
penile arteries to
Right.
say, hey, let's get an erection. But those nerves are very sensitive too. Like even if you have a surgeon who tries to spare those nerves, they get injured by even just traction, moving them out of the way. Thermal injury, from the cautery they have to
Yeah.
use to do the
Well, they got to
procedure. Yeah. So
keep the bleeding down because there's a lot of probably tiny blood vessels.
Can't they just ice it?
Yeah.
No.
Yeah. And people used to bleed a lot in the open procedures they used to do. For that was a relatively high blood loss surgery until the Da Vinci robot, came about, and they started perfecting those techniques, taking out the prostate, from more of a laparoscopic technique.
Yeah.
See, the robots are taking our jobs, Billy.
Good. It sounds like it was good. It's a steadier hand.
And it's gotten a lot better. When I first got into urology in 2006, that was kind of really when the Da Vinci started taking hold, and people who I used to see post-operatively then compared to now, patients are doing much better now. They're regaining continence much quicker. Erectile function, it's lagging behind a little bit. But again, at the end of the day, if you have a prostate that needs to be removed, the surgeon's number one priority is, make sure that cancer's out of there and it's not coming back.
Right.
Yeah.
That's the important thing.
Is it similar to a woman's hysterectomy type thing, or am I only in that it's sexual function, right? Cancer in that area.
Right. Yeah. There's, from a physical standpoint, there's quite a bit more collateral damage when you take out the prostate. Your urine goes right through the middle of the prostate. I tell patients all the time. I mean, think about your.
Yeah, it's like the Red Sea.
I didn't know that.
Yeah, you think about your prostate being like an apple that has been cored. Right?
Yeah,
you can see right through the middle of
right.
it. And that's right underneath your bladder. And when you pee, the urine goes right through the prostate. It's part of the prostate.
Yeah, it's like those aquariums where you walk underneath, you see all the fish.
Yeah. So if your prostate is swollen and that's where the song, somewhat jokingly saying it's 3:15 or it's 2:45 in the morning, I have to get up and pee.
Right.
Frequent urination is usually a sign of an enlarged prostate.
Enlarged prostate. Most of the time, yeah.
Why is that? Because it's pushing on the bladder?
It can imprint on the bladder. It can also, and talking about the apple, pretend like that apple all of a sudden starts growing in on itself. That core starts growing in on itself. So where you had this nice, patent space for the urine to go through, now it's not. So it takes longer to empty, and your bladder sometimes can only squeeze so much for so long. And you think you're empty, but there can be several ounces left in the bladder. So you're starting with, a third or half of the tank, and it, can keep waking you up. So those are the guys that are in the, you go into the men's room, at the urinal, you go in there and you do your thing, you pee, and you're next to the guy and okay, how you doing? And you leave and he's still peeing.
Yeah.
You wash your hands, you're leaving, and he's still in there. Huffing, puffing. Those are the guys who have a lot of prostate issues.
Ugh. Have you ever turned to a guy and go, you know what? Here's my card.
No. I've thought of it before. Like, hey, you know,
I think I can help you out with this. It seems like you're in a lot of discomfort.
Right.
But back to the masturbation. Is there truth to that? That not but sex or masturbation, ejaculation is healthy for the prostate, and is there sort of a balance? Like I think we read somewhere 3 times a week. I don't know if that's true or not.
In general, yeah, and this is something they've been looking into since like I think the mid 80s, and then every 5-10 years another study comes out, and what it seems to be is they've been able to stratify that there's an amount of about 21 times per month seems to be the the threshold where if you're at that or over, there seems to be a reduced risk of incidence of prostate cancer. And there's certainly more of an increased incidence for those who are at the 4 to 7 times per month.
Starting window, like at young ages or like throughout your lifetime?
They start looking at, people in their 20s and beyond, and they're trying to track these people, through a long period of time. And they go back and, there'll be people in surveys, and they get questions, and then every couple of years they send out the questions again, just to track their progress.
There is a movement right now. If you've heard of Dr. Jordan Peterson and Dr. Andrew Huberman and others, they have like joined this, what they call a no FAP movement, right? Which is an anti-exacerbation movement where because it has nothing to do with the prostate. It's the idea of your dopamine levels and your psychology that you're getting used to the same climax, that nothing can top that. So you're going to go and get crazier and crazier to try to overcome that dopamine hit that you get from an orgasm. If you're watching pornography and doing that all the time,
right?
And their whole thing is don't do it, just have regular sex. But a lot of people, you need someone to do that with, and if they don't have that, their recommendation will don't do anything. But it'll raise your testosterone. So there's like a trade-off to it. Does that make sense?
There is a little bit, and there's certainly there's a double-edged sword for that.
Yeah.
And it's more or less like what is your personality? There's you can give certain people alcohol and they can deal with it, but then there's some people who have a higher tendency to become addicts, and that can be a problem too. You talk about too much, like how much is too much, there's they don't say that in the literature, but when it becomes a social detriment to you, or you're late for work again, or you're doing that.
Yeah, I was jerking off. Sorry, boss.
Yeah, and you're cutting out time with your spouse and things like that.
The Wolf of Wall Street with
their
between like lunch and breakfast and dinner.
Erectile dysfunction, and maybe this isn't your area, but it's sort of in that adjacent area, I would think. It's a lot of times blamed on aging, but are there other contributing factors that we're not necessarily aware of? Like something that most people don't realize is actually affecting their erectile dysfunction, that if they eliminated, maybe it would, I don't know if it's going to cure it necessarily, but would certainly maybe lessen it.
Yep, for sure. And that is a very large part of my practice as well. I can't go 30 minutes during the day without talking about erectile dysfunction, it seems like.
Even in sleep.
Yeah. And even but you're right, there's it's kind of blamed on aging. Oh, that happens when you get older,
right?
But the most common cause and what happens as you're getting older is your arteries are getting harder. Atherosclerosis, the same thing that causes heart disease. So fun fact, men who are diagnosed or have erectile dysfunction earlier in age, in their 40s, you're actually at a much higher risk of having a cardiac event, higher risk of
while
heart
using
attacks,
Viagra.
strokes. Correct. Yeah. So it's, they say that a man's, erection is a overall barometer of their vascular health. So for all you guys out there, if you're having any trouble with that, get in to see a regular doctor, because that can be a sign of heart disease. If you have erectile dysfunction, especially at an earlier age.
What would you recommend then? I mean, honestly, like change diet.
Yeah, there's essentially anything you do that's good for your heart.
Yeah,
is going to be good for your erections.
Blood, right?
Yeah,
yeah.
the blood flow,
diet, exercise.
Yeah.
They say if you could do 40 push-ups in one sitting, that's actually a very good sign that you're not going to have a heart attack. The other one is if you do a rigorous exercise and get your why do you laugh every time I talk?
Because there's someone who's in the medical field in here.
I'm just contributing. He could
No,
agree
no,
or
no,
disagree.
I actually just read it. I saw an article recently that had there's like I didn't memorize it, but
Yeah.
there's benchmarks for at a certain age you should be able to do a certain amount of push-ups,
Right,
and if you're
right.
above that, there is an association with a lower cardiovascular risk with that.
The other thing too is
I just love the way Danny.
there's a test, right? That if you can get your peak heart rate like at 148 or 158 or whatever your peak is, you take 1 minute and you rest. And if that heart rate drops by 30 or more, or 21 or more, you're fine. If it's between 12 and 21, you're okay. If it's less than 12, then you're at risk for a heart attack. Like your heart beats. So, just if you do vigorous exercise, whatever that peak is, that number should drop significantly. And if it does, then you're not at a risk for a heart attack. I'm just saying, I just want our audience to be aware of those things.
No, I know.
Yeah.
I just like to give you that look because it makes you.
So my doctor tells me my cholesterol is too high, but everything else is working. I can come back to him with these numbers and say, look, don't put me on a statin. I'm fine.
Okay.
Then 5 years later,
Yeah, I know.
Why didn't you put me on a statin?
This is the thing. Like I sometimes go, I want to I have to trust the man
I know.
when it comes down to the.
They have the degrees. They have the letters at the
I know.
end.
I like to think.
Me, I'm watching YouTube videos.
But okay, so the argument that right, we can say that, and yet I think today you go to Apple University where they have courses and things that you can take, and you can probably get educated on something as well as you could maybe at a undergraduate level. Honestly, so I don't know.
Do you have to pay for it?
The Apple University.
Yeah.
Well, I'm just saying, like, I think there are like structured lectured classes that they film. I don't know. Probably yes. I'm sure you do.
Okay.
I don't think you have to pay what you would pay to go to St. John Fisher today.
Yeah.
But yes,
I got my degree
or definitely
online.
RIT. I think. I don't think.
We're Shannon Doherty. I got my degree online.
Yes, I did.
And then she died.
There's a lot of guys who. Okay, so this is one that I have heard about. Not sure that I really experienced, but difficulty with climax and or let's say just ejaculation. If that doesn't happen at all, but you sort of have the orgasmic feeling, is that bad? What is that?
Yeah, and it certainly happens. That part of it does tend to happen more as you age, and orgasm and ejaculation, they are usually, one after the other.
Right, sure.
But if nothing comes out, it's not necessarily a bad sign.
Okay.
I do have patients who I see not necessarily primarily for that, but in the realm of erectile dysfunction and prostate problems, they'll mention, oh my gosh, nothing's coming out. And it's really a matter of like separating the two. Like, okay, does it feel the same? If you climax inside something, you're not going to know what comes out.
In terms of the amount,
correct,
right?
Yeah. And then otherwise, it's just okay. Stop looking at it. Move on. You're good. But there are medications that can cause a reduction in that, particularly prostate medications to help.
Prostate
people
medications
urinate. Yep.
Can do that.
Like saw palmetto or
not as much as that, but
that's
your
supplement. But I don't know.
Yeah.
Right.
Well, Hulk Hogan was promoting this stuff called super beta prostate. No, I'm serious. The commercials were so cheesy. And Joe Theismann was doing the commercials too. No,
there's an educated.
No,
but hey, Hulk Hogan was telling me how to save my.
No, because he said there's medication, and I'm trying to say that there were these commercials out there where Joe Theismann and Hulk Hogan were promoting the super beta prostate supplement. They said it does as well as like 50 salt palmetto capsules, and my question was, is that stuff legit? Is that stuff real?
Yeah, I mean that sort of thing has been out for a very long time, and in the medical world, typically, as we're trained, you don't go out and lead with recommendations to take supplements and things. They're just the studies behind them aren't as robust. They're not as rigorous. They're not, you're double blind
and they're not regulated.
Controlled. Correct. But the other thing too, it's like you want to be recommending things that are, have some data behind it that shows that it works. And there's certainly nothing wrong really with someone starting out with something like that.
Yeah.
By the time someone gets to a urologist, usually symptoms are probably, pretty far gone at that point. And I do have people who want to go that route. There's very minimal adverse effects from, things like saw palmetto. So it's, if someone has very mild symptoms and that helps them, hey, great. I don't have a problem with that.
Mike Ditka did one as well.
Oh, did he? Okay.
Yeah, I think
I didn't realize he still had one.
we interviewed
prostate.
Mike Ditka, but it was some supplement as well. And it is funny,
Tristan,
but you have to look at the audience, right? If Hulk Hogan is talking to guys, a lot of guys will go, you know what? I should do that too. And I think that's part of the appeal. But it is just, to me, it's just that we have a medical professional and it's Hulk Hogan. Just made me laugh. Okay. I'm not laughing at you.
No, but I was going with the question. That was just that he answered it correctly. Like you hear these things, and I want to make sure the audience knows that,
Well, we do hear a lot nowadays.
Yeah.
I mean, if you're in a certain age demographic, you're getting targeted ads at you if you don't sign up for certain things. There's going to be a lot of supplement things. I mean, I can't tell you how much I get beef tallow to rub all over my face.
Oh, dude, I've got more beef tallow ads.
Like, yeah.
How about like pelvic floor exercise equipment? I get those targeted ads too.
I haven't gotten.
I don't know why.
I haven't gotten that.
It looks like basically, remember the Thigh Master?
Yeah.
It's exactly kind of what it is. Increase your pelvic floor strength, increase orgasms, and increase your penis strength. And I'm like,
what's your Google search history?
Well, no, it's like it just appears. I'm not looking this stuff up. It just shows targeted ads. I'm in my mid 40s.
I'm asking for a friend.
Yeah, I have some friends that have some questions too.
My favorite part though with Dad is Danny is still one of the most pure people I've ever met in my life. And he'll defend, he gets embarrassed and he'll defend vigorously over things like that. Who knows how they target it? No, but I'm serious. I don't know. So the ejaculation thing, not necessarily a big deal. What I was going to ask is, do things like, there are people that are on low doses of a fluoxetine or which is what the generic of Prozac,
SSRI.
Yeah.
So,
will those affect?
Yeah.
Unfortunately.
So it's one of the more common side effects, and not everybody gets it, but an SSRI that does certainly lower libido, lower sex drive, it decreases an ability to achieve a climax. Not everybody gets that symptom, but it certainly can.
If some people actually ask to have that problem.
Well, and again, in the medical world, we do treat people who have premature ejaculation, right?
Mm-hmm.
And there's ways to get around that, certain, psychosocial behaviors and, increasing activity, right? We were kind of talking about that. If someone's not very active and all of a sudden, it's, Friday night and a blue moon and, you're doing your thing. And if it's been a while, it may not take very long. But people who, through behavioral modifications, if it doesn't improve, SSRIs are a treatment of
really like almost an off-label treatment. Then.
Correct.
Yeah.
Dan Dan, I know a guy. He doesn't know that I know that we both know this guy who actually took Zoloft. No, it's not me.
Medical. No, I was just going to say medical HIPAA laws. Could we be careful?
No, I'm just saying. Only if you just say the name, right?
I know.
No, but he said that he actually went through this, and his wife actually got tired, and he went to his doctor and said, "I need help with this." And he goes, "Yeah, I know people who actually would pay for that problem." That's how I came up with the question.
Yeah, sure.
Because he would go on for like 90 minutes. He's like, "All right, can we go to bed?" And he wouldn't finish because he was on Zoloft.
Yeah. Well,
but then there's other SSRIs that like will actually make it fast. There's a side effect too.
I have no idea. I don't know enough about any of it.
Not that I've specifically come across.
Okay.
It doesn't mean it's impossible.
Okay.
But it certainly can slow things down. The people who have delayed issues, if there's not a medical, reason that we can find to help with that, you're checking a testosterone level, making sure there's not any, prostatic issue, treat that. Then you get into all of the, psychosomatic concerns, but, there's also off-label treatments to try to help improve, someone's ability to climax. And, again, that's where after you get past all the medical things, because as people age, you're looking at, again, atherosclerosis, hardening the arteries, reduced blood flow, lower testosterone levels.
Right.
And then also, the other thing that can happen is diabetes, nerve damage,
Right.
sensory nerves, peripheral neuropathy. The penis is kind of peripheral, so you get reduced sensitivity there as
Yeah.
well. So
Yeah. Okay.
smoking's a bad one too.
Yeah. Can you stay for a little bit?
Sure.
Okay. So why don't we take a break? I want to ask, and I don't know, I'll ask it before we go, but testosterone therapy stuff. A lot of mixed things that I've read a little bit, dabbled in.
My doctor told me no.
Yes, that's where I'm going. But boy, push supplement after supplement after supplement. And is it the natural way of aging for your body that is probably the most healthy way? And are there ways simply through diet and exercise that you can increase testosterone without having to maybe put yourself at significant risk?
Right.
We will get to all that right after this.
a gland, dear, and it's hidden deep inside. Has a shelf life that's hard to predate, 'cause we keep it out of sight.
Like a walnut
Kind of T-shaped.
near the bladder and rectum. Fancy gloves, oh, where's the doctor? If they check it,
I will say that I once had my prostate checked. This is I should. I just remember being really embarrassed that I think I had to go home. I wore, like, in the mid 90s, Gap had these they were almost white, but they were very light tan khaki pant. And I went to the doctor, had a prostate issue. He lubed up, and then at that time he wasn't saying white, you may want to wipe yourself, or he's like, all right, we're good. And I think I was blowing bubbles on my ass because there was so much lube, and I think it squished through, and I had like a dime or maybe a quarter size of the ointment or whatever, right? The lube through, because I was wearing boxer shorts at the time, and then I saw somebody like,
so you were like
home.
the poor girl who like had to take her sweatshirt and wrap it around her waist.
100%. Yes.
Then you did a commercial for Men's Depends.
No, well, I mean, it's one of these things, but I think that I think guys are more open to talking about these things today. One of my questions is, and I don't mean this in any way other than just out of curiosity, for men, it's probably easier to talk to men about this. Are there many or any that you are aware of female urologists?
Oh, there certainly are.
Yeah.
And we have quite a few advanced practice providers within our practice too. Physician assistants, nurse practitioners, and the overwhelming majority of them are female.
Yeah.
And it's just it's a comfort zone. Sometimes the man, it's just more of an embarrassment sometimes for them to see a female.
That's what I was going to ask.
That's what I mean. And some of these questions, I think that in America, we've done somewhat of a disservice. And I don't know, where everything's sort of cloak and dagger, our porn and everything. Now you can get it anywhere, but we're still doing it in the dark corners of our own lives. And I'm not saying we should talk about it, but it certainly seems like Europe is a little more open. Topless beaches, naked around the kids, not as much body shame. And we are. And I remember once having a testicular issue and going to the emergency room. And in comes the doctor who's going to check me out. And it's a woman. And nice, attractive, but it's just like, really, I mean, a doctor, right? It's got her shit together. And she goes, all right, you're going to have to. And so now I don't know what happens in my head, and I can do this with almost anything. I get to a certain point and I can almost turn off like any fear. I don't know what that is. I get to a
psychological.
Point. Yeah, I get to a point where I'm like, it could be anything, right? I mean, if I had, like, when we used to have to rappel, and we had a friend who also rappelled, and don't say the name, but he wouldn't do it down the side of a building. And I'll get to the edge of that, and I'll look over, and I'll get that same twinge, and then I'll go, I'll be fine. And I turn it off, and I can do that. Or I can go 140 miles an hour in a car and, just be like holding on. And then it's the greatest, most exhilarating feeling. But you're a little scared in the beginning. I can shut that off. And it's the same thing. And I remember looking at this woman going, she's like, yeah, I got to take a look. I need you to stand here. And she's now down like eye level. And I'm going, every guy is wondering how they measure up, what's happening, what's going on. And it's just clinical. It means nothing. She's not going to remember you. You're not going to, it's not, but we get
in our head,
fucked up in our head. Yeah.
We learned very early on, parts are parts, and it's just, to you, you're memorable, right? And
Sure.
but to the person who's taking care of you,
You're number
Right.
55.
in that situation, they're doing what they need to do, but it's a very, clinical, and usually as long as you have a general rapport with the person, it's hard in an emergency room to, you've never even seen this person before,
No, which was great.
but if you, and some people, if
For
it's
me, it
someone,
was like awesome. Okay.
yeah, if it's someone you've seen more, you develop a relationship with that person, and you decide like, okay, yeah, they're really serious about what they're doing here.
Yes.
And it's just anyone who's properly trained can do just as good as someone else.
Right.
When I was at one of the other urology practices, there was a female PA that we were training, and going through all the the different exams and stuff like that, and I was examining this gentleman, and examine the prostate, and he's just kind of looks at her. It's probably nerves and whatnot, and he's like, how do you know what you're feeling? Like, you don't have a prostate. And then I looked at him and I said, have you checked your own prostate? It's like, how do you know? You don't know. It's just all training. You know what I mean?
Yeah.
So
Great comeback, by the way.
Yeah,
man.
but it's and sometimes it's just men, you get uncomfortable, and sometimes the filter's off, and you say things that you don't really mean, and
That's
whatnot,
definitely a
but
guy thing.
sure, yeah. But it's more of a the more you go to the doctors, and I even have patients who come in to see me for various things, and I might say, all right, well, part of the exam would be doing a rectal exam, examining the prostate, getting an idea of what the pelvic floor is doing, and some people, you get the look, and you have all these other, comments that you hear, and it's, you just more or less, you go over, why are we doing it? Why are we checking? But if it's someone you're probably going to see again, it's, you don't have to do it today,
Right.
like if you want to think about it, give you a little mental prep time, and, we'll do it in another 6 months. So
I don't know why, if a doctor says to me it's probably a good idea that we check your prostate, and they're saying we should do that now, I wouldn't even hesitate.
yeah, in most do,
right. I wouldn't hesitate. And
Yeah.
I don't know why, but I guess because I've had the exam
Yeah.
from a younger age. We did bring up testosterone. There's a lot of supplements. You'll see it all over health foods, not health food stores, but like GNCs and things like that. A lot of ads that are pushed at guys. I think there's even one guy who is, I think Dr. Drew was part of his thing, but they had some kind of testosterone supplement. And one of the side effects is, well, it may make you a little more aggressive or angry. And I'm like, yeah, of course it does. What are the dangers with that? Are there? Or is it better to try to raise it naturally and let nature take its course?
Yeah, I mean, first off, if I see someone, it's, you look at the whole picture, and, and I may have hundreds of patients on some form of testosterone,
Yeah.
But the first thing is to try to establish a reason why not to give it, and if I can, and that person's feeling better, through, diet, behavior change, exercise, and we can see some data that's showing, hey, we're getting the numbers to move, correlating with, yes, I'm feeling better, then you keep, going on that path. And a big cause of that sometimes is men who have sleep apnea, snoring at night, not getting into a deep sleep, so for a guy, testosterone levels, they're never the same. You can check a testosterone level 5 times a day. It's going to be different every single time. It tends to peak in the morning.
Yeah.
So in general, stereotypically, men tend to be more frisky in the morning.
Yeah.
Right? And that's
the
when
morning wood songs.
it's when the levels are generally higher.
Uh-huh.
But if someone's not getting good sleep, they're snoring, they're sleeping 4 hours a night, you're not getting into those deep sleep cycles that trigger your body to say, hey, let's make more testosterone. So that can be priority number one. So
Morning radio sleep.
Yeah, there you go. Some patients I see, they don't even get on testosterone. They go back to their primary care doctor and say, hey, we saw Dan, and I snore all the time at night. Should I get a sleep study? And they do, and they get that fixed. And over the course of several months, the T level starts going back up.
Okay.
So there's a lot of.
Is it important for men to check their T level?
It's not a recommended, routine screening, because everybody's levels all over the place.
Sure.
Someone may be running around at 300-400 and they feel completely fine. Another guy might need 500-600. There's really not a test to tell like what is someone's threshold.
Right.
It certainly declines as we age. But there are things you can do to, increase that, like I said, sleep, good diet, you don't have to be a health nut per se, but in general, moderation, lean proteins, healthy fats that are in salmon, avocados, nuts, seeds, fruits and vegetables, zinc, vitamin E, all that good stuff.
All that stuff I eat.
The almonds I asked for on my rider that I wasn't delivered today.
And by the way, cinnamon. Didn't you say cinnamon almonds?
Well, it's just a nice little flavor.
Dusted. Well, I was going to say, I think cinnamon's pretty good for you.
Ceylon cinnamon is really good.
It is. Yeah.
That's
blood sugar control.
Because I have been told, and I think Dan said off Mike, I'm not sure if we were on at that moment, but we've been told of increased risks of cancer. I think you were told heart attack
and hair loss if you go through TRT therapy.
Okay.
This is what I was told several years ago by a doctor.
Yeah, and in the mid 2010s, there was some studies that came out that made people pause about that. There was a black box warnings that came out. And recently there was a very large study that was done, and essentially, more or less targeted men who were a little more unhealthy, that had cardiac risk factors, and they followed them for 5 years. It was called the Traverse study. And it just came out within the last couple of years. And essentially there was no increased risk in all-cause mortality. There was no increased risk in heart attacks, strokes. There was a very slight increase in AFib rates, atrial fibrillation, blood clots.
Got that one.
But nothing that led to death. Blood pressure might go up a little bit.
Yeah.
But again, it's all in the proper management of that. Some patients ask me, like, what should my testosterone level be? And if it's someone who we're starting on treatment, it's basically the lowest level that you can get by with during whatever treatment option you're using, whether it's a gel you're rubbing on every day, a shot you're giving to yourself once a week, hormone pellets that get implanted, every 3 to 4 months, long acting shots. They have testosterone specific pills now. So it's essentially that lowest level that keeps you feeling well and back like yourself, while you're on that. And it's a dose dependent thing. I can see, a dozen different people on testosterone, and they may all be on different dosings of different medicine. And it's kind of what works for them. But it's a very safe treatment when it's managed properly. You have,
so make sure you go to a doctor and not necessarily these supplements.
And I see people who've been in the the bodybuilding industry for years, and they come to see me and say, all right, listen, I just want to get clean. I want to do this right. I want to have somebody monitoring it.
Yeah.
And we don't have studies that say, oh, what happens if your T level's 1,000 all the time, and then you just kind of have to extrapolate, and you look at the
car doors off, flipping trucks off bridges.
Exactly.
I bench press my Tesla twice a week.
You look at bodybuilding industry. There is a higher risk of people just sudden death, that have been on very high level injections
everything
for a long time. Yeah.
Well, I think there was just recently a bodybuilder just died, like within the past 2 days. I came across 44-year-old bodybuilder or guy at the gym.
Wow. Well, it's about our age. I mean, well, it's funny because like Ken Caminiti, remember the steroid thing happened to baseball? He ended up dying. He had like the drugs, like later on stuff, but he didn't realize that when you took steroids, that steroid users typically cycle on and off. He just kept going and going and going. It didn't stop. And then when he stopped, all of a sudden he felt lethargic, so he kept going. And guys like Canseco were like, no, bro, you got to do it like this. That's how Canseco became like the godfather of steroid usage, because he actually, like, this is going to sound ridiculous, he introduced really steroids into baseball and made them more, I don't want to use the word mainstream, but educated a lot of baseball players on how to use them. Yeah. He was kind of like I mean, if you've seen Canseco today, he looks fantastic still. He's like 60-something years old. But like he did it like in a proper way. Caminiti was just doing it all the time.
I almost feel like there's a rise in, I don't know what the right term is, longevity doctors, but there are doctors who are doing different hormone replacements, and for men,
right?
And these things. And I always worry. I always go, are you making yourself more susceptible to something catastrophic versus actually helping your body? And I don't know the answer, and it sounds like if you do things properly, it can work out.
And I've been fortunate to take care of some people for over a decade now. And, people that they do well. I have so many people that say, that they get their life back. And one of the primary symptoms of low testosterone is just feeling like low energy. Like I can't get up and do that. Motivation. Like I used to go to the gym all the time. I can't get myself to go, or they go and it takes them 5 days to recover,
Right.
And just like mental clarity, mental fog, people are, say that I'm not as productive at work when my testosterone's low, so it's one of those things where you're looking at numbers, and there's guidelines that we use to, kind of use as a benchmark of, okay, should we start pursuing this or not? But if you have symptoms going along with that, it's worth exploring that and ruling out some other potential causes of it, first. And if you can't rule out any other cause and your only other option is to start testosterone, then that's a great patient to start that on, and they usually do very well, over a long period of time. We screen for prostate cancer. There's some data out there where the waters get a little bit muddy with prostate cancer and testosterone. One nice thing with that Traverse study that was done, it showed that there was not an increased risk in prostate cancer cases, right? So, as prostate cancer starts to, develop, change more, and it becomes more aggressive, then it does become a lot more responsive to testosterone. So people who have higher grades of prostate cancer, you got to pull that back and stop. We actually have patients who have prostate cancer. They've been diagnosed with a low grade prostate cancer. They choose to follow an active surveillance protocol where they're not having their prostates taken out. They're not getting radiation. They're not getting any other, focal, therapies. And, but they say to us, like, I can't come off of testosterone. Like I'd rather die than be off of this, like it's such a big change in their life to be on it. And there's people now who we follow who have prostate cancer who we're giving testosterone to.
Okay.
And you check their PSAs every time they come in, and, you just watch for pattern changes, and, you intervene if something goes off. You let your patient know.
Get to a doctor, fellas.
Yeah. Well, I got two buddies who are on
Yeah.
TRT, and every 6 weeks they're getting their blood drawn. They're getting checked out.
Yeah, it depends on what kind of treatment you're on. If I have somebody who's on, let's say a gel, or they're doing self-injections, it's a little more, visits in the beginning. But once someone's on kind of like an autopilot, it's generally a 6-month follow-up.
Yeah.
Unless something changes.
Look at that.
Yeah.
All right. Well, that's something to know, only
Yeah.
because I do think that you probably do feel better.
Yeah,
I gotta think you feel better.
It's and obviously, you
Feel
compare,
like I'm 19 again. But that's what you hear in some ads from guys.
right? Yeah,
And,
Yeah.
well,
I can resume my daily activities. They
Yeah.
show you at a park.
Yeah.
Yeah.
One
They
guy-
show you in 2 separate bathtubs overlooking a bluff.
No, they.
Cialis.
But
Which, by the way, the bathtubs in the Cialis, interesting story with that. When that came out, obviously that was for what?
erectile
Erectile
dysfunction.
dysfunction.
Yeah.
And then, middle-aged men started noticing, like, I'm peeing a lot better. And they actually went back and restudied it, and they have a secondary FDA approval for prostate-related urinary symptoms.
Oh, wow.
Really?
So it becomes
Cialis.
Yeah, and now it's generic. It's very easy to get. You can get it online,
Yeah.
but pharmacies around here, it's not expensive. You use one of those good RX coupons that you hear about all the time, and it's you're generally under $30 for a 90-day supply of that. But it's a great medication for the right patient who has prostate issues. They have some erectile dysfunction, and in an ideal situation, they respond to that Cialis. They take every day. Their erections are better.
They take it every day.
They're peeing better. Yep,
Yeah.
lower dose. Yep,
Yeah,
once a day. And it kills 2 birds with 1 stone. It's a great,
Yeah.
And unlike the other, going back to the ejaculation issue, the
Who cares
other
what that
typical
is?
typical medications with that, like you have your, they're generics now, but Flomax, Rapaflo, Uroxetrol, those medications sometimes can cause what's called retrograde ejaculation, or decreased sensitivity.
Wait.
You don't have to deal with that.
Retrograde.
What, is that like when it goes back inside you?
Yeah, it just doesn't go out forward.
Is that bad?
No.
Oh, okay.
But if you don't tell patients about it, it can be very concerning.
Yeah.
Oh my God, nothing's coming out.
Okay.
Yeah.
But does it feel
But-
better?
No, well, sometimes people have a sensation change with that. There's less of
Okay.
that rhythmic contraction that's going on. So, you know,
Danny, does
I'm
it-
asking the questions.
does it
that
feel better? Does it feel, I'm just curious.
Yeah, I have a friend who wants to have more powerful orgasms. Is that something you can work on at home?
I haven't developed that pill.
What do they do for? Is it, you did bring it up, and I think that I think a lot of guys, especially when they're young, premature ejaculation is not an uncommon thing. It seems to probably go away as you get older and you get a little more established in life.
Nerves settle down.
Yeah, nerves settle down, or even your confidence maybe is a little
Right.
more. And but what are there things that can be done that aren't necessarily medicine or something that I don't know. I mean, what do you do? Like I like a numbing thing sometimes.
Yeah, it's, you know, and there's a typical protocol is, you know, increasing the frequency,
Oh.
and then being more, more active more often.
Yeah.
Within reason, obviously.
Yeah.
And then, you know, there's techniques where, you know, foreplay, you know, don't touch anything, you know, like, because the more that things are stimulated, it elevates that level.
Yeah.
You know, and gets people closer. You know, barriers, you know, condoms, reducing sensitivity there. But yes, there are, you know, creams that came out.
Really?
I believe, I forget the show that it was on, but there's a product called Promescent, and it was featured on one of the talk shows. And I think sales.
It wasn't The View.
It wasn't The View. I think sales, I heard, went up by, I don't know, some ungodly percentage after that hit the air. You know, but
Really?
it's a spray. Yeah.
Yeah.
So you spray
Well,
it
because
on
the
and,
great
you know,
thing is, I know I got it. I don't want anybody else to know.
correct.
If there's a way that I can have it, you know, brown packaged to my door
Yeah.
and no one knows
Right.
what's in there,
Yeah.
that's great.
Discreet
Sample
packaging.
size.
Well, it is the way things, and
Yeah.
it is the way things now have gone in a lot of.
I got an order for Bill Moran, a radio host. Do you know where he lives?
But I think even for erectile dysfunction, I'm thinking like the hims and hers
Yep.
that come right to the door does make it a little more attractive just for some people.
It certainly does. And
Yeah.
it's, you know, there's pros and cons with that, but it has opened the door for people to start seeking, you know, treatment for that, for something that can be very distressful. You know,
Yes,
Oh, yeah.
yes, and
It's-
ruin relationships
yeah.
to a certain point, or
can.
shame, and
Yep.
yeah, it
Yep.
really does.
I see it all the time in my patients. They'll mention, you know, some men aren't as, you know, forthcoming with, you know, letting their spouse know exactly what's
Right.
happened, you know, and then, you know, the natural reaction is, what's going on? How
Yeah.
come you're,
You don't
know,
find me
who are
attractive
you? Yeah, like,
anymore?
who are you?
Yeah.
Right. It's a real thing.
Is it because I'm
um,
fat?
Right.
Did I get fat?
It's amazing how we get stuck in our own heads.
Well, we do, but
We do that.
but it
Yeah.
makes sense.
yes,
And-
it does. It
and
adds
that's
up.
what he's saying.
That's why he's here.
Yeah.
I would rather be the guy that goes to the pharmacy and says, "Hey, I got to pick up, and what are you here for?" And you go, "Boner pills," or whatever the real name is. And yeah, see, not that guy. I'd rather
Yeah.
look them dead in the eye and go, "Viagra. It's gonna be a hell of a weekend." You know what I mean? Just to me, because I think they'd laugh. They're
Oh, I tell
and the thing
people
is,
when I
like,
go
they
to the
give it out all the time. They don't care.
When I go
No
to
one's-
Wegmans, when I go to the pharmacy, I go, 4 prescriptions for Dan Borello. Yeah, I got problems. And they start laughing.
Yeah.
They try to help you out. Do you need to talk to the counselor? I go, no, I'm good. I know how to take these. Frankly, I don't even want them.
Speaking of counseling, that's another one in there that can be very helpful, you know, to
Yeah.
seeing a certified sex therapist, you know, someone who's, you know, trained in the whole mental, you know, psychosocial aspect about sexual function.
I have wanted to talk to, this will sound funny the way I'm about to say this, much like we're talking to you on the podcast, a sex therapist, and I can never seem to find anybody that's willing, because I think they all think it's going to be jokes or boner jokes. It's
Not
not.
giving our reputations.
Well, you put a little levity behind it, but I do think that there's a stigma, and if you can do something, I think all of life is lived in our head. All of our suffering is in our head. Our perception of things is in our head. And I'm not saying that medicines and things aren't needed. That's not it. But I do think when it comes to some of these things, to your point, it could be in your head, and people don't want to hear that. We want a quick fix. We live in an age where we want the answer now. And if it
Right.
can be in the form of a pill, please give it to me.
Yeah.
Better living through chemistry. I understand that. But if you can sometimes prevent that, because most of these drugs do have a side effect, maybe mild, maybe nothing, but it's for some people, like I've known people to take a pill that many people take, and they break out in full hives, right? And it's awful and it's itchy and they get scabs and it's not comfortable. If you can do something in your head, it may help.
Right. Yeah. And it's a, you know, it's a nice service to be able to have,
Yeah.
you know, and, you know, when you talk about erectile dysfunction, if, you know, someone in the, you know, not to necessarily say it's limited to younger population, but, you know, I do have older gentlemen too, who, you know, they get a few bad performances and it's, you remember the last time.
Right.
You
Your
know,
Yelp review goes down. It's terrible.
Yeah. It's right. You're
3 stars.
It stays in your head and you get performance anxiety.
Right.
You know, and it doesn't mean you're hyperventilating and sweating and all nervous and everything. It's just things you're thinking about in your head.
I just like you so much.
Does she know? Oh, did she figure it out? And you know, and then if you know, if the question gets asked, are you okay? You're done. You know, it's very difficult to recover after. Oh, my spouse knows. You know, and you know, so but you know, getting back to it, you know, if someone has more psychogenic erectile dysfunction, that's in general, it's almost like the best kind to have because that you can reverse. Right. You know, with clinical therapy.
Or new partner. No, I'm kidding.
That you know, it can go.
My doctor prescribed prostitution.
See a therapist. Yeah. So yeah, but all joking aside, that's, you know, it's a real thing.
It is.
You know.
Yeah. I always wondered, like, what do they, like a sex therapist, like what do they talk about? What are these things? But it is really getting into probably taking you to the moment, and guys. I shouldn't say no guys. I think many men are uncomfortable talking about that.
Right.
Yeah.
And it's, you know, and again, yes, it's the moment, but it's more about like, all right, what leads up to that?
Right.
You know,
it
can be some deep seated things.
Sure.
There's a lot of people who've had traumatic experiences and, you know, it's good in the right, you know, professional hands to get that out. And, you know, what do I do with it?
Mm-hmm.
You know, and I tell, you know, patients too, you know, if I recommend that, you know, and there's certain, you know, it's not there, there's not a blood test for it.
Right.
You know, so you're at the mercy of your provider who's watching how you communicate, what's your body language like, you know, what's your other past medical history, you know, and if they're able to pick out like, you know, I think there might be some psychogenic, you know, issues here to talk about. If you get to the right therapist, they're going to help get that out. They're like, well, I don't know what to say. Like, you don't have to worry about that. You just have to go there.
Yeah.
You know, and the right therapist is going to help get that out for you.
Yeah. It's all, I think, really interesting. I appreciate you coming in because I do think that these are things. Yes.
I do have one question, and I'm not shy about asking this. When I go to a Bills game, if there's no line at the bathroom, I can go. But if there's like people beside me or people behind me, like that shy bladder syndrome thing, is that a real thing?
It's a psychos. Yeah,
it is. Yeah. It's just you're
I asked the doctor, Bill. I didn't ask you.
Yeah, it's
well, I get the same way at a trough because somebody sprayed.
Well, that at a Bills game, right? Yeah,
I can't go.
Are they going to have those at the new stadium?
I hope not.
Highmark troughs.
Yeah, Highmark troughs.
But yeah, it's, you know, there can be tension and, you know, certain things. Like, you got to be able to relax. You know, the bladder does its thing. It's not gravity. You know, there's certain, you know, neurologic things that happen, and, you know, the bladder muscle squeezes, and your pelvic muscles need to relax. You know, if you're tight down there, it's not going to happen.
You mentioned pelvic floor a few times, and I think Kegel was something that was talked more for women, right? Or I've known more of women to do that. Is it something men should do as well? Pelvic floor exercises?
Yep, for sure.
Yeah.
You know, and that's you know, something where, you know, Dan talked about all these exercises and this device and that device. And, I coach my patients through some of this. Some have bladder problems, urgency, you know, just like, you know, anybody else, women. You know, sometimes having a good balanced pelvic floor can help, you know, get out of trouble with that. Sometimes there's, you know, certain things in sexual function where, you know, talking about climaxing too early, you know, sometimes it can be an imbalanced pelvic floor as well. But Kegel exercises, if you're doing them right, you can be staring right at somebody and you're not going to know that they're doing it. It's an internal, you know, contraction. Basically, it's like if you're doing a Kegel exercise, if you're peeing, if you can stop your urine in the middle of peeing, that's a Kegel exercise. But, you know, having the ability to have that control, but also relax. You know, sometimes if the pelvic floor gets too tight, you know, that can cause symptoms down there too. You need to, you know, relax that.
Yeah, it's a great party trick. They do that. Was it a Yankee player at Milwaukee Stadium or a Milwaukee fan at the Yankee Stadium?
There's a Milwaukee fan, I think, at the Yankee Stadium.
Where they just started to
Just
whipped it out, and started peeing.
Yeah, just whipped it out and just started urinating all over.
Right out. Yeah,
like in the concourse
Right in
area.
the concourse.
Like
I must say the breadth of your knowledge about this stuff is fascinating.
Yeah, it's
oh yeah, we're
It's a little-
students of pop culture. And
It's
sports.
always been fascinating since I've known you.
Yeah, yeah, I know a lot of stuff. I just can't
Yeah.
succeed in life. I don't know.
All right, we will take a moment. Feel free to stick around. We've got there were some other things I wanted to bring up. One was this young teacher who said, I think we talked about her once before, but she's back in the news, who says she's too hot. That's why she's being accused.
She's
of
the hot
sexual
girl,
minor.
the hot
Yes,
teacher,
hot teacher
defense.
defense. Yes, attractiveness, right? A little narcissistic, but we will we'll touch
She
on.
can't be as narcissistic as Snow White recently. You see that?
I haven't. We
Oh,
will
yeah.
touch on all that when we get back.
Right back. I got to do a Kegel exercise.
Hey girl, I got something real important to give you. So just sit down and listen. Girl, you know we've been together such a long, long time. Now I'm ready to lay it on the line.
Wow, you know it's Christmas and my heart is open wide. Gonna give you something so you know what's on my mind.
I forgot that it was Kristen Wiig and Justin Timberlake.
Take a look inside. Is my in a box? Not gonna get you a diamond ring. That's what
Like, the problem is, like, could you go out with Kristen Wiig and take her seriously? Like, would you think? I would think I wouldn't be able to tell if she was being serious or if she, you know what I mean?
I think that she is probably. Everybody gives Tina Fey and Amy Poehler all the credit. I think Kristen Wiig is actually right up there with them, if not better, because she could play anything.
Yeah.
Like Tina Fey, you're waiting for the punchline. Amy Poehler, you're waiting for the punchline. With her, you don't know. Like, she could totally, like, you know, punk you out. You'd have no idea.
Right. Yeah.
From Brighton, New York.
But you did this song.
Yes, Dan and I did this song. I don't remember if you did you do Timberlake and I did Sandberg, or was it vice versa?
Yeah, I was the Timberlake, the backup.
Yeah.
For that one.
Yeah.
That's awesome.
Yeah, we did that song back in like 07.
That is great.
Yeah.
How fun.
Key of F, I believe.
Yeah, it was Key of F.
That's really funny.
Then we had this guy from Mochester, like this guitar player, just show up and start playing, and then he just took over the song. And Dan and I are looking at each other
fantastic.
like, yeah, you did like a 10-minute solo. We're like,
leads.
yeah, like people forgot we were singing the song.
Well,
wow, there's a musician on stage.
Yeah, right.
this is something happens. I saw this story. I want to get to this story. Let me see if I actually did grab the audio from it or not.
Gainey County woman found out she won the lottery.
Okay. Yeah.
And then realized she lost the ticket. She left it in an old jacket that she donated to charity.
Bullshit.
That was an episode of the Golden Girls.
Bullshit. Well, you got, I don't know. This lady is claiming that she lost the winning ticket. How would you know that you had the winning ticket if you don't have
Gainey County
the ticket in your possession?
The only
that
way,
makes no sense.
The
to me.
only way I could see that is if you play the same 5 or 6 numbers every week and have for years. Does that make sense?
Okay, but
like there are these 2 guys in England back in the 90s who like played the lottery.
I put it in a jacket and then I donated it.
Yeah, it's ridiculous.
Yes.
But I'm just trying to give you like the 1% chance.
All right. Let me hear the rest of this.
Gainey County woman found out she won the lottery and then realized she lost the ticket. She left it in an old jacket that she donated to charity.
Talk about a nightmare. The winning lottery ticket, it's not a small one. It's worth $2.5 million. Her name is Mildred Simona Reluto, and she said she bought the ticket at a grocery store last May.
That sounds like somebody who would do that.
Hey, I won, but where's the ticket? That's when she remembered she had put it inside a jacket that she donated to Vietnam Veterans of America.
I was stupefied. There's no words for it. It was like beyond expression. How can I get it back?
The organization donates clothing around the world, so that jacket could be anywhere. PA lottery officials told Simone Reluto she must have the ticket.
It's covering some kid in a
it expires on May 8th.
Some kid in a Chiefs winning Super Bowl 2024, 2025
or a Bills winning Super Bowl.
Yeah.
Right? You know, I mean, it's funny. Like Mildred Chicaluso or whatever.
Yeah.
Okay, that's like my Aunt Millie like won a lottery ticket, but she put it in the jacket she gave away to charity. That was an episode of the Golden Girls. Sophia did the same thing. She had a winning lottery ticket. She put it in the jacket. They donated. They ended up sleeping at a homeless shelter that night. And at the end of the episode, the priest who's running the homeless shelter, Father, these people need this lottery ticket more than I do.
Why do you remember?
I just remember all this
the
stuff.
Details of the Golden Girls.
My wife and I actually like watch it when she wants to go to, so she has to have the TV on when she goes to bed.
When is it still on?
Oh, it's on Lifetime. I think it's on Hallmark Channel or one of those channels.
Okay.
Because all these channels basically just promote each other now. They're all owned by like 4 companies. So, but yeah, the Golden Girls are on like binge.
That was after he finished Three's Company.
Yeah, I'm I love that you do that. But now there were some internet rumors that they were going to bring back the Golden Girls.
Yeah, I heard about this.
Well, I don't know if it was ever real or somebody fantasized this and they put it on social media, but Maya Rudolph was going to be part of it. Lisa Kudrow was
Phoebe from Friends was going to be on it. Yeah,
she was going to play. I think who was
they're going to be the daughters
Rose.
of
Rose's granddaughter.
Yeah,
Rose's granddaughter, and then but they're also in their 50s now themselves, which I think the Golden Girls were in their 50s when that show started.
No, they're in their 60s. They played people in their 50s. I looked it up.
Oh,
because I'm like, oh my god,
are you sure?
Yes, Blanche I think was the youngest at the time. Blanche or Sophia, because Sophia wore a wig and actually was one of the younger ones.
Okay.
B. Arthur and Betty White were the oldest, and then Rue McClanahan, and then Estelle Getty. By the way, the entire cast of the Golden Girls, like everybody, not just the girls, but even like the guests and all that stuff, most of them are all dead. I mean, the show wasn't off the air that long. It ended in 93. It feels like yesterday. But I mean, I remember every Saturday night, Grandma's watching us. We're watching the Golden Girls. And all the dirty jokes we didn't get that got over our heads, Grandma would start laughing.
Yeah.
And we'd laugh because, oh, it's funny. No, you didn't get the joke. We're just laughing because Grandma's laughing.
Oh, okay.
And then you get older, you're like, oh, that's what they meant. Okay.
Well, anyway, I think that story, that lady is trying to pull a scam and get some sympathy. I'm waiting for the GoFundMe to happen for the lost lottery ticket.
It sounds like something a Mildred would do.
That's just exactly.
And a story a Mildred would make. I had a bingo. I had a bingo.
Danny had breaking news that we may be losing a running back.
James Cook, Buffalo Bills running back, has put his Orchard Park house up for sale after Brandon Beane earlier this week said that he doesn't foresee any more contract negotiations. The Bills have actually extended 6 different players, just not their running back who wasn't on the field in the last 9.5 minutes of the AFC Championship game. And I can understand James Cook, his brother's Dalvin. He wants to get paid. His brother, wanted to get paid. And the thing is, running backs nowadays with today's NFL are a dime a dozen. And he has Ray Davis is right behind him. So is Ty Johnson. They could grab somebody on the draft or off the street and replace James Cook. I mean, the guy
Cook had some great games, but
don't get me wrong, he was the second best player in that AFC Championship game.
Right.
The problem is that if you're not on the field in the game's biggest moments, how valuable are you?
Not very.
That was the knock on Willis McGahee. Why isn't he on the field in the late fourth quarter? Because he can't pass block on third down. Mm-hmm. So once your best player, if he's in the backfield, if he's not in the game, that means they're throwing. Dead giveaway.
Right.
You're throwing because he can't pass block.
Giveaway.
Dead giveaway. And the Bills didn't have to go no huddle.
No.
They could have run a 4-minute offense and won the freaking game, or at least kicked the field goal and tied it and sent it to overtime.
Yeah.
I'm sorry, Dad. I get really ticked off when it comes to.
I was right there with you.
Yeah.
Are you a big sports fan? Were you to Dan's level? Maybe
not even close.
He tried out for the Tour de France.
No.
Did you really? Were you a cyclist?
A cyclist, not in to that capacity though.
And
we did a 24-hour race here, didn't you?
Not the 24-hour, the downtown Criterion.
The
that they used to
Criterion.
have. Yeah. So there was
really cool.
1 year that I got. It was a pro category 1-2 race, and there was 1 year where they had category 2s in that race with the pros. So I was lined up under the lights, and people around. It was a crazy environment.
Yeah.
It's like
but
the whole city used to come down there.
It was a really cool event.
Yeah.
And it was those bikes were tight. I don't know how you maneuver.
It's fun. It's just muscle memory. But I didn't do very well. I was,
so
riding
but
with
you
kids
did it.
half my age, and it's just you hang on a little bit, and there's that big slinky that happens. You get towards the back, and when you're going around a right angle corner, it slows down. You get a lot of whiplash in the back, and you're riding twice as hard from the back as the guys in the front. But it's just to keep up to that level. It's just you got to put yourself somewhere where you've never been before to get up there.
My old neighbor was part of the Bud Light team years ago, and he trained out in Aspen and stuff. He would jump on his bike, and he was older than I was, and I was probably in my mid to late 30s when he was my neighbor. He would jump on his bike and crank out 90 miles in the morning.
There's training rides, weekends. Yeah, that's like nothing. Almost.
What is the hill? You probably know it. Along Canandaigua Lake, down, I believe, the west side of the lake.
Bopple Hill.
Yeah. Is it it's one of the? I don't know. In terms of a grade, it's supposed to be one of the toughest in the.
Been a while since I've been down. I think it's close to
14%.
Or
yeah, I didn't want to misspeak, but
it'll put hair on your chest.
Yeah, he would ride that.
Yeah,
like
Yeah.
up.
Yeah. Yeah. And it's not an easy ride to get there either, you know.
No.
So it's not like you drive your car to the bottom of the hill and go.
Wasn't there like a hill that Stephanie I tried riding on
Yeah,
with a Turk Hill? Yeah, I mean that's nuts too.
Well, Turk Hill is big, but this is like
Is it gradually getting?
It's almost like I think it's almost like
It's very steep.
steep up and down.
Yeah.
And
You're not sitting on your bike.
And this guy, I remember he would come over with his kids once in a while. We had a pool. He could do I think it was like 16 by 32 pool, but he would swim underwater from the shallow end, deep end, and back without
breaking his breath.
Yeah.
Holding his entire breath.
Yeah.
I thought you were going to say he did the ET over my house with the basket.
He didn't. No, it was amazing. Like the guy had, and I said to him once, I go, one time he's just standing there in shorts or something. I go, holy Christ. He looked like my kid's action figures, his legs, upper body. Yeah. But this was, yeah. And the guy he was really into cool shit. Like he had a kayak that I tried to sit in shallow water in Lake Ontario. You had to have, it was like so balanced, and it was all about core strength. He would drop that in the canal at Bushnell's Basin, and he would row out to work. He worked at Kodak, but the grease office, and he would paddle out and then paddle back. That's what he did that's how he went to work some mornings. I'm not kidding.
By canoe.
by this kayak.
By kayak, rather.
But the kayak that was, honest to goddamn, I couldn't sit in it. Like I have a kayak.
Or else you feel like you're going to tip over one side or the other.
No, you do tip. Like I couldn't. I tipped. You had to have. It was like one of the shallowest shells. It was practically to the water. I don't even understand. And he went and bought this thing on purpose for yeah.
Well, they say rowers have like the biggest hearts, like physically. And
yeah.
Like the
well,
best
I would
core
think
strength.
cyclists too, and runners.
Yeah.
And yeah.
The long endurance, activity, and you're pushing, definitely anaerobic going up those hills like that.
Yeah.
And that's after you've been riding for so long. And
what is your here's a really odd question, but we did talk about somehow cardiovascular health and how it all plays in even to your urology to a certain extent, or at least your penis. What is your resting heart rate? Do you know?
What, me personally?
Yeah.
Oh, not what it used to be. But,
so because mine's in the mid 50s.
Yeah.
And then if I can kind of almost get into a meditative state, about 2 years ago, I did an EKG and the alarms went off because it dropped below 45 beats.
Yeah.
Yeah. 45 beats a minute. It was down like 43 or 42. I can do that. And I think a lot of that was I ran for many, many years when I was young. I'm overweight by 40 pounds right now and all this. And I still know that my heart rate overall is probably at a resting rate of between 52 and 55.
Yeah. And sometimes it's genetics too. And you put the two and two together and you got a good,
yeah, I'd like to keep it that way.
But. Yeah. So it's, you got some good genetics. So
well, right there. But I think a lot of it was, even the exercise early on, because I ran all the time and I loved it.
Right.
I loved it. And then I certainly haven't been doing that lately. Yeah. I even was told by a young child that reached up and touched my stomach and goes, "You got a Santa belly."
Now that it's cardiovascular exercise,
Yes.
it's helpful for downstairs.
You got to get going, man.
Yeah.
Well, I do spin classes once in a while. I love the spin.
Those are great.
The spin classes are some of my favorite. Been doing a lot of endurance in this spin classes.
Yeah, it's important.
Yeah, get that.
Do you still fly planes?
Wait, you fly planes,
I do
dude?
not fly planes anymore.
Oh no, but you used to.
I used to. I did get my private pilot's license several years after I got out of college. Because why not?
So to fly
for fun.
For fun.
Yeah.
Flying what?
Single engine.
Yeah. My brother was flying single engines when he was, I don't think he had his driver's license yet, out of a place called the Rhinebeck Aerodrome downstate. And he used to fly over our house. And my father decided he's just a great man, but a little strange, a little weird, did everything himself. So he's redoing the roof, but it's different shingles coming on. And my brother goes, "So I flew over to the house, Dad. It looks like shit. You got to get that done." I always thought that was so funny. I never would go up with, I don't think I ever got invited to go up with my brother, but I never did. Yeah. And then he went to Indiana State for flight school, and then had an engine stall, I thought hit a wind shear as well. I don't know, but for whatever reason decided this wasn't the path he was going to go in.
Yeah, it's you got to be doing that often, and that's why I got out of it. I wasn't flying as regularly as I probably should have. You know, there's minimums, standards where you have to, keep current and whatnot. But if you're at the level where you're just, flying to keep current, you got to have everything, quick and sharp and be able to react to those emergencies.
Look at you, man. You've lived the rock star life. You did your own flying.
He was a photographer at one point, right?
Probably
just amateur.
Yeah, but that's cool stuff. I think that's great. And
husband, dad.
Yeah. And
actually did flying. I actually did get to, you're talking about taking people up. I did take my 80-year-old grandmother up at one point. Helped her get up into the plane, and we took a nice tour down, past down to Letchworth, saw some sights and everything.
Oh, that's cool.
Coming home, and of course I got my license, did my training at the big airport, so coming back in and landing, and of course there's a crosswind landing, and I was like, all right, Grandma, plane's not going to be looking like it's going right at the runway when I'm landing here. She's like, okay. She was just calm, cool, and collected. And,
because if this is how it ends, it's fine.
She was okay with that. She lived her life. Well, she grew up back in the day where she knew farmers, and they would go up in crop dusters. And those guys are insane pilots.
Yeah. I always wanted to do a glider where they they pull you up and then they just let you go. It just looks so cool to me. And I would think it's pretty safe.
Yeah,
for the most part. There's no engine.
Keep your altitude where it needs to be, and slow descent.
My uncle was a pilot for Delta, and he would never do single engine. Would always go, we can't do that. But
backup.
No, there's no backup. But that's what most people learn on.
That's where you got to
start. Yeah. I think Anthony Daniele from the Daniele family of properties,
enterprises.
Enterprises. Thank you. He flies, and he'll fly up to Boston to see his son. Lives up there.
He'll like go there for lunch and come back.
Yeah.
They have fly-in breakfast sometimes too.
They have what?
They fly-in breakfasts.
What is that?
That people do. They rent their plane and they go fly to some small airport and small town, and they all have breakfast, and like come back. It's like the $100 pancake breakfast.
Oh, it's amazing.
There and back.
Yeah, I remember hearing about there was I hurt my back, so I didn't end up going to my cousin's wedding, but I was talking to one of the chefs who used to work at Wegmans, and he goes, yeah, I got on a plane with Danny. We flew out to that restaurant in Park City, Utah, and flew back. I was home in bed, in my own bed. I go, that's the kind of life I want. Because I always think that there's different, I've said this too many times and I'll repeat myself again, but the different levels of money, right? There's the, the rich guy, then there's the people who have fuck you money, right? You scratch my car, I'm just going to go buy a new one, fuck you. And then there's the fuck me money. And the fuck me money are the people who just burn it, don't even care. Like I say Galisano is my hero because he fights all the bullshit, knows he's going to lose. He fought goose shit. Who fights goose shit? Goose shit on his property. He went after the town for not controlling the geese population, which I wonder if they did start to do it because we didn't hear as many complaints. And it's not just his property, but he has the money to go, I don't give a fuck if I win or lose. That's the fuck me money. He fucked himself. I go, that's amazing. That's the rich I want to be. That's the rich I want to be.
Aspirations.
Yes, it's aspirations. All right, we'll close it out. I apologize. I hope I didn't embarrass anybody with that one. But I think great information about prostate health and overall sexual health for men, which is something that I think is really important. If somebody, I'm sure they need a referral to get to.
Usually not.
Usually not.
Yeah.
Oh.
I do have, referrals from, outside, from primary care doctors.
Yeah.
From sometimes within, urologists,
Yeah.
who, you might be having kidney stone problems, and then, you have another issue, and they'll say, oh, go see our sexual medicine team, and, they'll help you out with that. But yeah, you can call up a urology practice and say, hey, I want to get seen just like the old days.
Oh, you can?
Yeah.
Oh,
I do have some people who are self-referred.
Did not know that.
Get 10 of them, and you get like a free appointment.
they all want it. It's, who referred you, and they'll ask for that, and but it's you don't have to go through separate channels to get in to be seen.
Yeah. Okay. Well, that's interesting because I thought you did have to like go to your primary first, and then they had to refer you.
Yeah, I think a while ago it was more like that. So.
Okay. Well, see, I'm old school. I'm old school with the health. Dan, it was a pleasure. We learned a lot of stuff.
Thanks for having me. Yeah,
reconnecting with Barillo from the old Diggler's Bridge days.
Yep.
And Danny, always good questions. I don't mean to make it. I love though laughing. I love how serious you get. It's my favorite.
I appreciate it.
Yeah,
so I had
the intelligence. Yeah.
We had one guy calling the break going, "Hey, tell Danny to shut up."
Oh, all right. It's Vinny. Loves to get under your skin. It's all right. All right.
I've lived a life.
I'm Bill Moran. Tomorrow's someone's birthday, or maybe today, as you're listening to this, we'll be celebrating tomorrow. I can't imagine who it is. We'll see you tomorrow.
The land of opportunity for me is just a curse. Tell that judge he make us feel. My title have to wait.